Okay, 3, 2, 1, go.
Good evening, everyone. Welcome to tonight's online meeting, COVID-19 and the disproportionate impact on BAME communities and BAME deaths. As you know, that today is International Workers' Memorial Day, so it's a timely opportunity to discuss the awful impact on the coronavirus on Black and minority ethnic communities. We've got a wonderful panel of guests joining us this evening. But before we begin tonight's meeting, I'd like to pay tribute to a dear friend that we sadly lost at the weekend. We lost our dear friend and long-standing anti-racist campaigner, Jude Woodward. Jude was an officer of Stand Up to Racism and Unite Against Fascism. Jude was a magnificent anti-racist. I first met her when she was a coordinator of the National Assembly Against Racism, where she worked with Diane Abbott and many others from 1996 to 2001. Jude organised the anti-racist festival Rise from 2000 to 2007. And I must stress, Jude was very cool because Jude made sure that bands like Public Enemy, Run DMC, and De La Soul headlined the festival. She did that because she wanted to ensure that African, Caribbean, and Asian youth were engaged in the festival. Jude led campaigns against fascism. The picture you see on the right is Jude leading a brilliant demonstration against the English Defence League in Walthamstow when we defeated and outnumbered the EDL with local Muslim community and labour movement. Jude would have been furious about the disproportionate impact of COVID-19 on the BME communities, and she would have been very proud of tonight's meeting. Jude was a remarkable socialist and above all, a wonderful and kind human being. We send our deepest condolences to all Jude's loved ones, some of whom have joined us this evening, and comrades whom she loved dearly. I personally will miss her very much. Thank you. So today's meeting, as I said earlier, it's International Workers' Memorial Day. Today we observed a minute's silence to respect those that have sadly lost their lives due to the coronavirus, many of whom were key workers working on the front line with insufficient PPE. We've got a wonderful panel joining us this evening. Reports have emerged over the last week or so of doctors and nurses saying that they feel disproportionately targeted to work on COVID-19 wards, and more doctors and nurses are saying that they feel like they have inadequate PPE in comparison to their white counterparts. So this is a very important discussion that we've organised today. So without further ado, I'd like to welcome our first speaker. I am very pleased to welcome our first speaker, who is representing every doctor that has mounted brilliant national campaigns, attracted attention from national media about the lack of PPE for medical staff in the NHS. I'd like to give a very warm welcome to Dr. Siema Iqbal.
Thank you, Sabi. Thank you for that introduction, and thank you for having me speak tonight as well. It's really apparent that COVID is disproportionately affecting the BAME community. A report that looked at the first 3,800 patients on a critical care unit showed that a third of those patients were from a BME background. Compare that with them making up 18% of the population. If we look at the deaths that have happened, sadly, of doctors as well, most of all the doctors, only one was from a non-BAME background. 44% of NHS staff is from a BAME background, yet 72% of deaths in the medical field from COVID have been from a BAME background. Even if we go across the shores to America, you can see that Hispanic and African communities are being more disproportionately affected by COVID. there's a lot of discussion as to why this is the case, and we can talk about underlying illnesses. So things like diabetes, you're 6 times more likely to get if you're from a BME background. If you are from a Pakistani or a Bangladeshi background, you're more likely to have higher risk of getting heart disease. There's also a lot of discussion around vitamin D and obviously the increased risk of hypertension if you're from a Black or African background. But you can't talk about underlying health issues without talking about structural health inequalities. And health inequalities isn't a new phenomenon in this country. You know, we've got to understand the social and economic factors which drive a lot of these health inequalities, and also remember that the role that racism plays in the social and economic factors that are driving the health inequalities. You can't talk about the underlying health issues on their own. You know, if we look at BME communities, they're from some of the more poorer socioeconomic backgrounds. We already know that 46% of Muslims you know, live in 10% of the most deprived parts of the UK. There's a lot of poverty, there's a lot of ill health. You know, we've seen the child poverty statistics. You know, if I could quote, 59% of Bangladeshi children live in poverty. You know, there's a lot of poor housing, there's overcrowding, and you also, you know, some of it is cultural. You know, we do like to live with, you know, in multi-generational households, but there is overcrowding in the housing. And then when you look at the messaging that the government put out around COVID, it wasn't targeted at any BAME communities. A lot of the messaging was in English and on platforms, you know, that they wouldn't readily access. Even the letters that were sent out to ask patients to shield were in English. And it's only very recently that those letters have gone out in other languages or are available in other languages. BME communities are also more likely to be doing more of the frontline work, so more of the precarious jobs, whether it's, you know, Uber drivers, cleaners, bus drivers, or healthcare workers. And that, you know, that leads me on to talking about the doctors, you know, the increased death rate that we're seeing in the medical profession, especially in doctors who are from a BME community. I think doctors that are from a BAME background often struggle or find it difficult to challenge authority. So if there is a lack of PPE, I would probably be more confident to say, you know, the PPE isn't adequate. Whereas for some who are in lower positions within institutions or, you know, or are on more precarious incomes, they might not want to raise their head above the parapet. And also, we already know that BAME doctors are likely to face bullying and more likely to be complained about. You know, if you look at the GMC referrals, there's a disproportionate amount of referrals of ethnic minority doctors compared to their white counterparts. You sometimes hear that, you know, people from a BAME background are being asked, you know, you could use the word forced to work in more high risk areas, and they're not necessarily going to say no to that. And we already know the situation with PPE, and if the PPE isn't readily available, then these doctors are putting themselves more at risk of catching the infection and, you know, possibly death, as we've seen so far. If we were to talk about PPE, it's being shambolic. The government's handling of it has been terrible. Look, every doctor have done a lot of work around PPE, and the guidance, you know, the PPE that's available, the guidance set out by public health doesn't match the guidance that's set out by the World Health Organization, and there's no clear evidence as to why there is this discrepancy. Is it because supplies are inadequate, which is really frustrating because the government knew the pandemic was coming. It wasn't a new thing. You know, we knew back in February. Why were we not better prepared? Why were resources not in place? You know, and I can speak about the Panorama program last night, which talked about the fact that we just didn't have the PPE stockpile, despite, you know, knowing in 2009 we had warnings that we need to make sure that everything is stockpiled, yet we had no gowns, no visors, no swabs, no body bags. And this was revealed last night in the Panorama program. Do you know, when you hear that nurses are having to wear bin bags, or doctors are having to go to their local DIY stores to get masks to protect themselves, or schools are making visors for practices, it's really frustrating. It makes you feel like you're not valued in the NHS. So I think I think there are so many issues to cover over why there's this disproportionality of deaths, you know, in the BME communities, and we need a fair, you know, fair independent inquiry into this, and preferably one that isn't headed up by someone like Trevor Phillips.
Thank you, Siema, for joining us this evening, and hope you enjoy Iftar this evening, and Ramadan Mubarak to you. I think Siema touched on a number of issues there, and I think institutional racism seems like a bit of a factor in medical staff working in the NHS at the moment. I know Mary has messaged in saying that we need more PPE now for all key workers, especially BAME workers who are disproportionately affected. So thank you for that, Mary. Our next speaker is someone who played a brilliant role in campaigning for justice for the Windrush generation. He's also launched a petition calling for one of the hospitals to be named after Mary Seacole. I'd like everyone to give a very warm welcome to Patrick Vernon.
Good evening, everyone, and comrades. It's really great to have this important event tonight, looking at the whole issue around deaths in the BME community, the lack of support for BME frontline staff, and what we need to do forward. There's lots of things I'm going to say, but I think I've got about 4 minutes. So the first thing, yes, I did launch a petition about 2.5 weeks ago that the Nightingale hospitals, which there are about 7 now, one of them should be named after Mary Seacole, particularly at the NEC in Birmingham. But as you probably gathered, despite 15,000 people signed the petition, a lot of media coverage, NHS England and Matt Hancock have just continued to name these hospitals, which are, and some of them are actually not being used effectively. There was this expectation everyone would be rushed into these emergency field hospitals, but the one at Excel and the one at the NEC it's not even reaching capacity, and it raises fundamental issues. Did they get it wrong? And should there maybe more investment should be done in community testing, PPE equipment, and supporting those people in care homes? But we'll see what happens. I spoke to Trevor Phillips yesterday, and obviously there's been a lot of debate about the Public Health England review which they're spearheading. And Trevor Phillips, I spoke to him, known him for many years, and obviously I don't agree with all the views and perspectives he has. But just to let you know, for the record, everyone, he is not leading the review on deaths in BME communities at all. It's been led by Kevin Fenton. He's the Director for Public Health for London, and he's been commissioned by the Chief Medical Officer to lead a national review in the UK, working with the Scotland and working with Wales to look at the disproportionality. What Trevor Phillips' role is in this review is he's the director of a tech company, and they're simply providing some analytical support to the review. So I think we should focus on what the wider issue is more about. We need a public independent inquiry on deaths and the lack of support to BME staff on the front line. The review that Public Health England is doing is a scientific review, looking at evidence. What we need is a proper independent review, and I'm working with an organisation called Iqbal, who organised a successful meeting last night, looking at the impact of COVID on BME community, particularly the vulnerable sector. Over 2,000 people registered, that entered and listened to the conversations that took place around big issues affecting the community, stuff around food, around access to social care, the impact of socialisation and social distancing. So I think that's really important that we kind of focus on that. And they've launched a petition on 38 Degrees. We're really grateful for everyone, and I'll put in the chat room for everyone to support that petition so we have a proper independent public inquiry. The other thing I want to touch on is on a personal level. COVID has hit everyone, all households up and down the country, but we all know the deaths in BME communities. I had a personal tragedy in my family. My sister's partner died of COVID 2 weeks ago in Derby. And as a family, we are grieving. We're trying to understand why did it happen. We can't believe he's dead. And it's really hard. And this is applying to all BAME families around the country. And we want answers in many ways, whilst recognising what the NHS did the best they can. So one of the key things I've launched, again with Ubele, we've launched a fund called the Mzansi Fund, which is a Swahili word meaning grief or deep sorrow, because thousands of BAME families around the country have lost loved ones, frontline workers, people in the community, and their lives have not been recognised. Some families have not been able to go and say their last farewells to their loved ones. Some people have not been able to go to any of the funeral burial arrangements, and because of social distancing policy, we're not only limited in number. So many people will have to organise, like we have to do, organise our own event post the lockdown. So the
Have we lost Patrick there? Hello, is that better?
Yeah, I think I was muted.
Oh, how did that happen?
You must have pressed a button somewhere, or the gremlins,
It wasn't me.
or maybe Donald Trump or whatever. I don't know. No idea at all. We can sort that later. Hopefully, they'll give me.
Can you 30 seconds because we're running out of time.
2:45. So we launched a fund. I'll share the link on the as well. And also, one of the big issues around bereavement is a lot of BAME communities need the proper cultural support around bereavement as well. I think the final thing I want to add before we finish is we all know what's happened around the frontline staff. I used to work in the NHS. I've worked in mental health.
All right, sorry, Patrick, I'm going to have to stop you there because your time is now up. So I think you were muted because you've gone over your time. So really sorry about that. But I just want to tell you that Stand Up to Racism very much agrees with the proposal for the independent public inquiry. So we should join forces and talk after tonight's rally. And I agree with you about the inadequacy of Trevor Phillips leading Public Health England's inquiry. It's adding insult to injury because he's been so offensive to many communities. And I think the call for an independent public inquiry answers some of the questions that people are asking. So Justice for Black asked what's being done about nurses feeling disproportionately targeted. And I think that's the only answer we have to have, an independent public inquiry. So thank you for that. So I'd now like to welcome our next speaker, who is representing Unite Scotland BAME Committee. So our next speaker is Fayrouz Kraish.
Hello, thank you. First of all, I'd like to say about the amazing solidarity today that all workers who have taken the minute's silence in the International Workers' Memorial Day, everyone stood together and remembered the dead and are willing to fight for the living. I work as a biomedical scientist in blood transfusion hematology at the Greater Glasgow and Clyde. In my workplace, we don't have direct contact with patients. We only receive blood and issue blood and blood products as they are needed. Though through testing patients' samples, we have learned a lot about how this virus works and its effect on patients. And this has contributed to clinicians in the way they're able to manage patients and hopefully save their life. This pandemic has highlighted many issues, particularly in failures in the government, stigmatisation of certain communities, social problems, and of course, a climate. The NHS has been under-invested for decades, with many hospital closures, lack of beds and privatisation, and this has all led to the problem that we see in the NHS. In Scotland, there was an initial problem with PPE, but now this has been rectified and we have plenty of PPE. However, social care workers and care homes are suffering the most and they don't have access to PPE, not enough anyway. So this begs the question, Is there logistical and distribution problems to social workers and care homes? If so, how do we support the distribution PPE equally across all workplaces and key workers? I would like to stress that every single life is precious and that this virus does not discriminate. However, looking at death statistics, the disproportionate effect of COVID-19, ethnic minorities cannot go unnoticed. Siema Iqbal has already mentioned the statistics involved, and they're absolutely shocking. There is a clear disproportionate effect to the ethnic minorities. So is there an inequality at work? We are aware that BAME workers are more likely to face disciplinary action and bullying from managers and colleagues. They are also less likely to report discrimination. They work longer shift hours to raise money to send away to their families in their the country of origin. Many migrants, asylum seekers live in deprived areas and overcrowded houses. So there are many social factors that could contribute to their health and of course make it more likely to contract diseases. We need, like Patrick has already mentioned, we need an open, transparent and thoroughly vetted participants in investigation into disproportionate BAME deaths. Also, who is responsible for vetting the participants, making sure that there is no prejudice judgment being made? So that's very important. The Home Office have taken a complete U-turn on migration policies. Only 3 months ago, people referred to as low-skilled workers are now seen as essential workers, and they've been bringing back to this country. There is
So is I'm assuming we ran out of time there. So thank you very much for your contribution. I'm so sorry that we had to cut you off. We've got a very packed platform. So just before I introduce our next speaker, I just want to give a shout out to Salma Yaqub, who is watching online. Hello, Salma. It quite rightly says that Trevor Phillips should be nowhere near an inquiry into the disproportionate impact on BAME communities of the coronavirus, and frequently employs Islamophobic tropes and is part of the problem, not the solution. Thank you, Salma, very precisely put there. So I'd now like to welcome our next speaker, who is representing the FBU. Welcome, Cameron Matthews.
Yeah, thank you for inviting me tonight. It's a horrific set of circumstances that we all face, but I think it's an important topic we do need to discuss. But firstly, I just want to pay tribute to NHS heroes and all the key workers that are keeping the country afloat. If it wasn't for your work, placing yourself at additional risk, we'd all be in an even more dire situation now. So I thank you for that work. As an FBO official, like many others, I represent members that undertake work which is inherently dangerous. So when provided with the added risk presented by coronavirus, it's been quite challenging to rapidly but adequately negotiate robust control measures that would safeguard our members, their families and our communities. And the added threat presented by the highly contagious nature of coronavirus and the implication that brings for others does sometimes get forgotten or inadequately accounted for by those in the decision-making roles. Because of course, it's not just our members in harm's way, it is their families and their colleagues, and they can all contract COVID-19 and can be taken home by our members. But we also equally need to protect vulnerable members of the public who we may visit whilst on operational duties. And that's if we're not provided with adequate PPE, safe systems of work that protects all parties, that can become an additional risk. So when we view all of the situation that we're facing through the lens of this recent data regarding the impact of coronavirus linked to ethnicity, I think it's an aspect we need to really take due regard for. The data now shows that there is a disproportionate impact of coronavirus upon BAME communities, and therefore I think it's incumbent that an equality impact review must form part of any governmental strategic risk assessment. I think it's important that we analyse, discuss and address causation in a sensible and appropriate way. By reviewing the mechanisms by which coronavirus transmission is made, so safety measures like working at home, social distancing and not working at all, of course, aren't available to all people. So I think it's possibly likely that the disparity of contraction rates between different ethnic communities can be explained by long-standing and unresolved socio-economic factors, much of which is stemmed from well commented upon and systemic and institutional issues associated with race and its intersectionality with class. So in short, if you are from a working class background, like many of us are, it's much more likely that you won't be able to work from home. Furthermore, many of these roles are now considered key workers, and so you probably are still being asked to attend work. You're probably still using public transport, and thus your risk of exposure is much higher, and your risk of higher viral loading is also increased. But of course, if you're a city banker or a CEO working from home, ordering your food from Fortnum and Mason's delivery and traveling by car with access to private testing, you're probably at a considerable lower risk of contraction. So although much of it is around class, I think what it highlights is the higher ratio of BAME workers in working class roles. And the situation is, of course, compounded then when employers don't provide adequate protections, such as where we see absences of PPE, safe systems of work, or routine testing for healthcare workers. Many people in the UK are dying at alarming rates at the moment, and it's a rate which is on a trajectory to be one of the worst in the world, particularly when we include healthcare deaths. So in this context, I think it's fundamentally important to acknowledge and tackle the disproportionate death rates within BAME communities. We need to dig into the data. We need to do it soon to protect the health, safety and well-being of people, and that will help us save lives. Thank you.
Thank you, Cameron. That was a brilliant contribution. You're quite right there. So just to lots of comments on the situation in the NHS. So Sahala says that there is still bullying and racism of BME NHS staff. So that's obviously a factor in the disproportionate impact on BAME key workers. Jack mentioned, asked what the TUC is doing on PPE. The TUC quite rightly called for a public inquiry into the woefully inadequate PPE, and I think we support that call, but we also want a public inquiry into the disproportionate impact on Black communities. So great comments there. Please keep those coming in. It's great to have the audience engaged in what we're doing. I'd now like to welcome our next speaker, who made a brilliant contribution at our last online meeting. Please give a welcome to a paramedic who's in the GMP. Welcome, Esme.
Thank you, Sabi. And as a paramedic, I am used to talking about death and seeing death. But I never really thought in all my time in the NHS that we would be here talking about the deaths of so many of my colleagues and friends across the NHS and across social care. And today is International Workers' Memorial Day, and up and down, not just this country, but internationally, there have been protests, minutes silence, moments to remember the people that we've lost. And as many speakers have said already, we know that we are losing our Black, Asian and minority in greater numbers, the numbers both in the population and to the numbers who work in the NHS. And, 70% of nurses and midwives who have died during the coronavirus crisis in Britain have been Black, Asian or ethnic minority. These are shocking figures. And I think they've shed a spotlight on the level of racism, injustice, and all the things I agree with Cameron about the intersection between race and class here, about the and also about the institutional racism that exists in our health service that actually disproportionately places Black workers in lower grades, in more dangerous situations, and less able to speak out and fight against bullying and for proper safety at work. But I think we also have to remember, as well as remembering all of our colleagues today, we have to remember the special contribution, I think, by migrant workers in the NHS, because more than half of the health and social care workers who have died from coronavirus were born overseas. So these are people who have come to Britain, who have faced the scapegoating and the racism and the disgraceful surcharge that is placed on their right to seek healthcare in the country that they're working. And they've faced all of those obstacles, and yet they've contributed so much. And so many of them have now contributed with their lives. And we have to remember every single one of them because they are dear to all of us. And so today it's right that we had a minute's silence, and it's right that we shared that minute's silence around the world. But it's also right that we stop being silent now, because those deaths are not inevitable. It is not inevitable that health workers are dying, that other key workers are dying. And so we need a public inquiry. That is absolutely needed, but we can't wait for a public inquiry. We need action. We need the sorts of actions that we've seen today that say we want PPE now, we want proper PPE and not to be fobbed off by government lies, and we want proper action on tracing and testing. But also when it comes to BME and migrant workers, we want an end to the disgraceful surcharge. We want an end to the hostile environment. We want action against institutional racism. We want the right for all health workers to speak up, wherever they come from and whatever their ethnicity. We want the right to remain and full citizenship for people who have come to this country, who have contributed and have given, often have given with their lives. We want the right to work for refugees and for health workers, and we want action for those things and not just words from the government.
Thank you very much, Esme, for that brilliant contribution. Very much agree with those points. So some of the points that you've raised, Standards Racism is also campaigning on. We included the demand for more testing and PPE for workers right at the beginning of the lockdown in the middle of March. So we very much support that. We've got Oktay Shabazz, who is a supporter of Stand Up to Racism and a great activist, who has messaged in saying that trade unions must do more to encourage BAME communities to join trade unions. So, because obviously more BAME communities joining, that would be part of the solution to get more equality in the workplace. So excellent point there, and lots of people supporting the call for an independent public inquiry. And Preston Windrush is thanking Patrick Vernon for all his work. So thank you for all those comments. So keep those coming in. Our next speaker is here representing the RMT. I'd like to welcome Glen Hart.
Hey, firstly, thank you for inviting me to speak on Workers' Memorial Day. I think this is a fitting tribute to commemorate our comrades who have all lost their lives in the line of duty. Today's news from TfL is that 34 transport workers have lost their lives as a result of this virus. While that demographic hasn't been broken down into ethnicity, the assumption is that most, if not all of them, are Black and ethnic workers. And there's another statistic often overlooked when talking about transport workers being key workers, and that's one of our outsourced workers, especially cleaners, with their predominantly migrant and ethnic workforce, who are treated as an invisible workforce. Indeed, when you look at that 34, that number of 34, that does not include the cleaners that have died who have lost their lives. These workers have been the real driving force in ensuring essential services run at this time without adequate PPE, proper sick pay, and having to pay to travel into the most expensive city in the country. And yes, while it's true, this government has blood on their hands, and I challenge anyone to say otherwise, the major disappointment and the biggest letdown for these workers is not the Tory government and their buffoon leader. It is the chair of TfL, the London mayor, who is a Black man, who should relate to the plight of these workers, especially being the son of a bus driver. Recently, we made the demand for cleaners on London Underground stations that they should be given free travel on the tube. TfL flatly rejected this, and now the multinational private contractors who made an annual pre-tax profit of £3 million last year are seeking to furlough the majority of these workers. That's why it's imperative we end the outsourcing of workers on London Underground and in other companies. All transport workers are key workers. We need to end this exploitation of workers and definitely end it because of their being Black, ethnic or migrant. So that's why I've agreed to speak today, because I'm really seeking support for these workers. You know, we really need to mount the campaign. We need to support as much as possible. I'll post links up to websites later, but we have been working on this for a bit of time now. So whatever could come out of this meeting, if we could really support these campaigns going on to protect these workers, that'd be a great help. Thank you for the invitation.
Thank you so much, Glenn. That was an excellent contribution, and we're very sorry to hear that 34 transport workers have lost their lives. And I'm sure you're right that the majority of them are from BAME communities. Lots of great comments coming in. Rogelio says, has quite rightly pointed out that a lot of Filipino nurses have lost their lives as a result of the coronavirus crisis and working on the front line. And many are pointing out that a lot of medical staff are from different countries, as many have pointed out, but their families are facing deportation. I mean, that's horrific. To lose a loved one in an awful, pandemic such as this, and then to face deportation. I mean, that's clearly unfeasible. It's not going to work, and that's why Sanitary Racism is calling for an amnesty for everyone. So for all workers that don't have legal status, for their families, and for everyone stuck in the asylum system, everyone must have indefinite leave to remain. And that way we solve the problem of lack of access to public services, no recourse to public funds, and the NHS surcharge. All of that goes if everyone has indefinite leave to remain. So thank you for that contribution, Glenn. I'd now like to move on to our next speaker, who is representing the Muslim Council of Britain. I'm very pleased to welcome Tabetha Bhatti. Is Tabetha here with us?
Hello. Hiya.
Hi.
Can you hear me?
Hi, yeah.
Brilliant. Thank you for having me. So I'm just going to crack on because we've little time. Essentially, we all recognise that COVID-19 has had a huge impact on BAME communities. Muslims overwhelmingly come from BAME backgrounds, and so our struggles are one and the same. Might I take a moment on this International Workers' Day to express solidarity with communities and workers so adversely impacted by COVID-19. The first NHS workers in the UK to die from coronavirus were Muslim, all from immigrant backgrounds. BAME workers are hugely overrepresented in the NHS workforce, for example, sustaining the operations of the NHS. This in the face of years of far-right rhetoric, blaming immigrants for draining the NHS being a burden. We have carers, delivery drivers, and transport workers now deemed essential key workers, who have historically been looked down upon for working low-paid jobs. These very frontline workers will continue to struggle to be able to come to the UK under a new points-based immigration system. Overworked, underpaid, and wholly undervalued, these workers are the very people that this country now depends on so greatly. Given BAME communities are being so disproportionately impacted by COVID-19, it is essential that the government reviews this. We welcome this advent and this announcement, that it looks into the reasons why and takes concrete steps towards change that prevents such tragedy going forth. We must, however, champion the identification of the structural issues resulting in these deaths and subsequent action that addresses these very structural issues, not piecemeal gestures. We need this inquiry and we need it urgently. On this, we all agree. However, we don't need an inquiry that risks to whitewash the issues at hand, not tell us the true story and fail to stem further loss of life. We need an inquiry that holds the confidence of the very communities it is supposed to protect. In its current form, it may well not do this. The fact that Public Health England, for example, has appointed someone who is under investigation for Islamophobia and has been suspended from a party in lieu of said investigation, someone whose appointment has resulted in a cross-section of BAME communities, organisations and individuals expressing opposition to the appointment, to support this inquiry shows the matter is not being taken as seriously as it should. Workers from BAME communities, including Muslim communities, are losing their lives every day on the front line, in hospitals and at home. And the likes of Trevor Phillips, someone who portrays Muslims as being alien, who pushes this divisive narrative of Muslims being apart from the rest of society, is appointed to the very inquiry seeking to establish the facts resulting in this tragic circumstance. We need to get to the bottom of why our BAME brothers and sisters, Muslim or not, are losing their lives. By appointing the likes of Trevor Phillips, for example, Public Health England risks it seeming as though this inquiry is just a tick box exercise. We deserve better. Adil Tayal, the organ transplant consultant who was the first NHS doctor to die in the UK from COVID, deserves better. Arima Nasreen, the 36-year-old nurse from Walsall who died, deserves better. Rahima Bibi, the care home nurse who died of COVID, deserves better. And indeed, every worker whose names remain unknown to us deserves better. Thank you.
Thank you so much, Tabetha. Very concise and brilliant points there. I'd now like to welcome our next speaker. Before I do, I should let you all know actually that we've got 1,600 people, over 1,600 people viewing this right now. So hello everyone, and thank you for tuning in. So we've got, I want to also announce and just remind everyone that we do have Diane Abbott and Jeremy Corbyn joining us later. So they are still coming in. So please stay tuned in to this very important meeting. Everyone's making brilliant points. So I'd now like to welcome our next speaker, who is co-convener of Stand Up to Racism, along with myself. Please welcome Wayman Bennett.
Hello, everybody, and I'm glad to be here. But to be perfectly honest, I'm not going to pull my punches. Like Patrick, I've lost family on this. 45,000 people have died, more than that died inside the Blitz. I do hold the government responsible for this. I think that Boris Johnson described black people as grinning pickaninnies, as Muslims as looking like bank robbers. By the way, everybody's walking down the street looking like bank robbers now, and there doesn't seem to be a problem. There was never a problem in the first place. We need the truth. We need an open inquiry. Trevor Phillips is unfit to do the inquiry simply because he denied the existence of Islamophobia. And personally, I'm sick and tired of people attempting, I think the government's tried to do this, to divide black and white, and also to divide different communities against each other. And we should be clear, the hostile environment that's been built has led to many divisions. Instead of spending £80 million on prevent, we should have spent £80 million of preventing the virus from taking place. We should have been using that money in order to make sure that everybody was kept safe. The Windrush environment, Islamophobia, these things have prevented us from being able to deal with this problem. I think that Boris Johnson's unfit to deal with this thing. I think Matt Hancock has let people die. The slides that I put up, it's the anniversary of Mohammed Salim's murder. He was murdered before these events. We should understand that a terrible tragedy is taking place, and I accept that there's supposed to be differences. I don't think they're genetic. I think that the way that class cuts across race means that people's lives are shorter. I spoke in a meeting in Islington last week where people were telling me that if you live near a road, your lungs could be smaller because they're infected by pollution. And our call is very simple. We want a public inquiry. I don't want an inquiry that was like the Scarman inquiry when I was growing up. I want an inquiry like the McPherson inquiry. I welcome Doreen Lawrence's participation in what's taking place. But ultimately, this is one of the most serious problems that we've faced, and we cannot simply go back to work. They put forward the idea of herd immunity. Herds get slaughtered. We are people. We should not allow people to lose their lives. People should be kept safe. No return to work until people are safe. PPE, and we want an inquiry that's got teeth, and we want an inquiry where everybody is properly represented. Remember the dead and fight for the living. Let's stand unity, and let's have no whitewash over this. Let's have a proper inquiry and amnesty for refugees and migrants. So I'll stop there.
Thank you, Wayman, for that brilliant contribution. And you're quite right to mention Mohammed Salim and solidarity with Maz Salim, who's been actively campaigning for racial justice since her father sadly was murdered 7 years ago. Lots of people supporting an independent public inquiry. Hazel is saying it shone a light on the inequality in the NHS, the current crisis. And Nadia is saying that she does think that BAME workers in the NHS are being pushed onto COVID ICU wards. So that's all very worrying. I should also mention that Doreen Lawrence was invited to speak at this meeting, but she was sadly unable to join us, but she did send this meeting her very best wishes. And also just to remind everyone that Diane Abbott and Jeremy Corbyn will be joining us later. There's a lot of you watching or asking that. So yes, please stay tuned. They will be joining us soon. So I'd now like to welcome our next speaker, who is here representing the Jewish Socialist Group. I'd like to welcome David Rosenberg.
Thank you and greetings. As well as the Jewish Socialist Group, I'm active in the Labour Party in Islington North, Jeremy Corbyn's constituency, where I've helped to set up a discussion page on our branch website focusing on the political side effects of the virus that the media downplays, and also develop ideas about the political changes that we need. I set the ball rolling on that with a piece about coronavirus and racism, and some of my messages tonight are based on that. Coronavirus attacks black and white, gay and straight, old and young, prime ministers and homeless people, but it impacts on different communities in different ways. It shines a powerful light on the existing inequalities and the vulnerabilities under a government inspired by eugenics that regards the elderly and disabled as collateral damage and shows little concern for the minority communities among the very hardest hit. Migrants and members of BAME community, as others have said, are more concentrated in low-paid, unsafe work, including the frontline provision of health and social care. They live in more crowded shared accommodation where it's hard to self-isolate. The ultra-Orthodox Jewish communities in Hackney also live in more crowded shared accommodation and have high infection rates. One significant community leader there, a long-standing friend of both Diane Abbott and Jeremy Corbyn, who I knew personally, was Rabbi Pinter, many years a Labour councillor. He died from the virus recently, aged 70 years old. In the Jewish community I grew up in, relatives of people I know have died in their 50s and 60s, and my aunt is very ill in hospital with coronavirus right now. More recent immigrant communities, though, are directly affected by the hostile environment. Undocumented workers are scared to approach health services, not only because of charges they think they'll incur, but because the Home Office pressures the NHS to share immigration data. Campaigning groups among NHS workers like Patients Not Passports, Docs Not Cops, who are resisting the hostile environment, have to be supported. Migrants who are deterred from seeking medical help through racist policies are a risk both to themselves and to others if they contract the virus. The really tragic thing is that among asylum seekers and undocumented workers, there are qualified and skilled health workers prevented from using their skills. When the crisis eventually subsides, we will face an economic recession. The racists will try to exploit these circumstances and shift the blame towards minorities. They're already rehearsing. Near where I live, there are stickers on lampposts attacking asylum seekers and promoting race and nation. Far-right conspiracy theorists, they spread their own hate on the internet. The former UKIP leader, Gerard Batten, has targeted the Hungarian Jew, George Soros, in tweets about coronavirus. He asked, how much money will George Soros make out of it? Fascists in America attack the lockdown as a plot against the people. They've been driving around parading anti-Semitic placards depicting Jews as rats with the words, the real plague. But conspiracy theorists are also spreading among some Black African communities who have many reasons not to trust the government, not to believe, and to believe that capitalism will further exploit peoples of Africa. We need to challenge all conspiracy theories. We need to honor the memory of the high proportion of NHS staff fatalities from BAME communities by campaigning for the NHS, combating the hostile environment, combating the conspiracy theories which weaken, divide and disarm us all. Thank you.
Thank you, David. We've had some brilliant contributions coming in. So Sally says that Johnson and Hancock have blood on their hands. And Rona's asking what we're trying to achieve out of this meeting. I think what we're trying to achieve is to highlight that what's been announced so far on looking into the disproportionate impact of the coronavirus on BME communities isn't adequate. We want an independent public inquiry like the Stephen Lawrence inquiry, because so far no one has announced that they're doing that. So, and no one's really called for it. So we're joining forces with Patrick Vernon. So please look out for our petitions and campaigns on that after this meeting. So I'd now like to welcome our next speaker, who has been a long-standing supporter of Stand Up to Racism. She's here representing the CWU, who have been a fantastic union in supporting our work. I'd like to welcome Jane Loftus.
Okay, thanks, Sabi, and evening to everyone. It's been an exceptional day today, Workers' Memorial Day. Usually it happens, not as much notice, but you look today and you look on the social media and around, even on the television, and the fact that Johnson and others come out for their minute silence. To me, at the moment, it was brilliant to see all the workers doing the minute silence, because people are truly hurting, whether you know people, whether comrades that you know have died, or whether people in other workplaces, and you can see what the health workers are doing, and in particular the care workers. So you got a real feel for it in the minute silence, but also it shows such a contradiction. For postal workers, we announced our national ballot result literally about 3 days before the lockdown, after we've been taken to court. And I don't think there's been a sort of true expression of what is happening in workplaces. And the deaths of BAME members are also interlinked with that. We have had to fight tooth and nail every inch to get anything off our employer. And there will be hundreds of thousands of other workers who aren't in trade unions who are having to fight on a daily basis. There's thousands lost their jobs. And as the weeks have gone on, it has been right that you can now see on the mainstream media where the deaths are. And it is workers, and it is Black and ethnic workers. You can see it, they can't deny it. So I support the call for a public independent inquiry. You know, I think we should all want to know why such a group of workers have been so impacted upon. Given that we should have all been safe going to work. Do you know what I mean? So it shouldn't be disproportionate. And I know when we've done our minute silences, I'd say ours is disproportionate as well. But it's not, as I say, because we don't test, because we don't track and trace, you can never get to the end of that. We're going into an economic crisis, if not already in an economic crisis. The Tories will do anything to disunite us. They will do anything to move on from a subject that will shine a light on how they've dealt with the pandemic. And they will do everything. So today, and I've not long got off conference calls, in Royal Mail, they've announced that they're changing how we work. Week's notice, no negotiations with the union. It's payback time, because they're going to make workers pay. So we have to make sure that what is happening now in the pandemic doesn't get forgotten, and then doesn't become part further down the line of how they're going to deal with the crisis. We will see more jobs go. So we stand shoulder to shoulder with you with the call for the inquiry. It is so needed, and I think it's people are receptive to that. But we have to make sure that we cannot let them divide us, because if we think this is hard now, I think the next week's coming up for us when we see thousands more workers going off the line when they try and crawl back any penny. That will mean we need to unite and fight together. And we've proven in this country who are the real workers, who are the backbone of society. And it ain't the hedge fund managers, the CEOs, or any of them. It's ordinary workers. We should make sure they get paid to do the jobs correctly, They should have PPE. If they haven't got it, we shouldn't be working. And we have to be as clear about that. No one should die because of the pandemic. So we support you and solidarity with you, and anything we can do now and into the future, of course we will do. Thanks for listening to me, and it's been a great evening, and I can't wait to hear the other speakers as well.
Thank you, Jane, for that spot-on contribution. We've had some great comments coming in. So Connor says that the government surrounds itself with alt-right supporters and eugenic supporters. Good point there. And Azante says that the government must be held to account for the disproportionate deaths of BAME communities during the coronavirus crisis. So thank you so much for those. Keep those coming in. And I've got more good news. We've now got 1.7 thousand viewers tuning in this evening. So that's fantastic. But I'd now like to welcome our next speaker, who has been brilliant and perhaps one of the first people in the public domain really trying to hold the government to account and asking all the difficult questions since the start of the coronavirus pandemic. I'd like to welcome Belle Ribeiro-Addy MP.
Thanks, Abby, and thank you to everybody on the call. It's International Workers' Memorial Day, so I wanted to start by paying tribute to all of the workers who have lost their lives to work-related illnesses and injury. The coronavirus only highlights how bad this is, and being safe at work should be an absolute right and not an afterthought, as it is far too often. Now, those of us who first raised that it was clear that coronavirus was affecting BAME communities were called racists. And we were told you can't keep looking at it in the sphere of race, and you need to understand that the disease doesn't discriminate. But even if this disease doesn't discriminate, it definitely exacerbates our existing discrimination and inequalities in our society. Now, the government started off with a completely irresponsible approach, that herd immunity approach, put forward by their eugenicist sympathising advisors, and look at where it's gotten us. Thousands and thousands of people have died. And I look at the PPE and testing scandal, and it is completely scandalous, because we've got a situation in which other countries are sorry, somebody just called me. In this country, we're being horrible to people, even if it's something that will exacerbate the virus. So, for example, you've got other countries that are offering residency rights to migrants. We're maintaining detention centres and no recourse to public funds. And migrants are scared to access healthcare. And some of those that work in the NHS are still being asked to pay the NHS surcharge. And we're so obsessed with maintaining the hostile environment that we won't even allow asylum seekers who have medical expertise to join the NHS and work to help us combat the virus. And you've got this while other countries are providing universal basic income. We're leaving people self-employed in limbo and offering small businesses relief in the form of debts. And Cuba is sending doctors around the world, and instead we've got our staff in our chronically under-resourced NHS using bin liners to protect themselves. All of this in the 6th largest economy in the world. And they keep calling it the fight against the coronavirus, and if that's the case, we've been doing it with one hand behind our backs because of the austerity over the past 10 years, which has meant that we have a greatly diminished workforce. And the government is so obsessed with privatisation that we've outsourced our purchasing of tests and PPE. So we've had 3 companies in this country that have been producing tests, and instead we've gone to look to other countries to buy it. We refused to join the EU's collaborative purchasing scheme, and there are other countries in the UK that have also offered to provide PPE. Funnily enough, we spent £16 million on tests from China, which the same country that the government seemed to be blaming the virus on, and those tests didn't work. And then we ended up having to send a charter flight to Turkey to pick up PPE. Turkey, the same country that people said would join the EU and swamp us, and that's why we had to leave. Now, health inequalities have always existed in our communities, and I'm glad that there is a review into what's happening, but it's not going to be as simple as Black people have hypertension, Asian people have diabetes, and we all need to go back to where we come from in warmer climates to help us with our vitamin D deficiencies. It's not going to boil down to things like that. The review can't ignore the decades of evidence which explain the lack of equitable healthcare in our communities. And if we had known this before, and if we had, valued this type of information before, we would have wanted to deal with these issues. We would have accepted the institutional racism that already exists and put things in place to prevent the disproportionate deaths in the BAME community. And unfortunately, that's why I've become a bit cynical about some of these reviews and inquiries, especially when they're into BAME issues. It just seems like a lot of the time we rehash information about inequalities that we already know. This review has to be different. People are literally losing their lives at an alarming rate. We can't have a situation where we're going back and pretending that we found new things that have already happened. And that's why the terms of reference of this review are so key, and they should be taking the evidence as we had before and actually looking at some of the views and what they have proposed before. In fact, the last good review or public inquiry that I can remember, and it has been mentioned before, was the Lawrence inquiry. And that's because the terms of reference were so well put in that they touched and concerned anything that had to do, any issues that arose with the death of Stephen Lawrence, and that made a difference. And from there we were able to have a situation in which we brought forth legislation, which if it had been properly implemented over the years, things would have changed. Unfortunately, the person who was tasked with that was Trevor Phillips. And that's one of the reasons, just one of the reasons why he should go nowhere near this, as far as I'm concerned. And I'm sure many people on this call will agree. Sorry, and I will somehow, the main point I wanted to make is that this review needs to mean something. This review needs to mean change. I don't want to see another copy and paste PR exercise that we make a load of noise about and say, gosh, the BAME community is disadvantaged. And I don't think we should have a situation where we are literally just making the case again and again that they're disadvantaged. We need to implement all of those measures that people have been asking for years and years and years to make changes in our community. Thank you.
Thank you, Belle. I'd now like to read out another comment from one of our viewers. So Sapna is saying that a lot of Hindu and Sikh workers have lost their lives as a result of being frontline key workers. It's quite right. Valerie saying that she's so glad that Belle is her MP. So I'd now like to move on to our next speaker, who is Vice Chair of Stand Up to Racism, and she's also MP for Edmonton. So please give a warm welcome to Kate Osamor. Is Kate with us?
Hi, can you hear me,
Hello.
Sabby?
Hi,
Hello.
hi, Kate.
Hi.
I can hear you. Yep.
Yes. Sorry about that. I think my internet's a bit unstable, but I'm here. You can hear me. That's amazing. Thank you so much. Thank you. Thank you so much for hosting this really important event. I think I'm not going to rehash what people have said, but the essence of, this debate and this platform is to make sure that not only do we ask for and demand for an independent inquiry into the fact that the government have first and foremost told us that they were prepared for this COVID-19. When we look back at the timeline, if we go back to the 31st of December, the Chinese authorities notified the World Health Organization to tell them about this outbreak of what they thought at the time was pneumonia. It was later confirmed that it was COVID-19. It was at the end of January that the World Health Organization made it clear to everybody that there is an international outbreak of a disease which we all need to be prepared for. So we had the information, we knew what we needed to do. The government then made a very woeful attempt to put in together a strategy claiming that they were ready, they were prepared. Their them being prepared has meant that we've lost people on the front line. We've lost people, as Belle said, we're not surprised by the outcome. We know that we are disproportionately represented, in the NHS. We've spoken, people have spoken about the various sectors where we are losing people, whether it's the bus drivers, whether it's people, working in care homes. But we knew this. We knew who was going to be at the brunt of this preparedness, as this government has said. And we need to remember that those people who said they were prepared, they don't know what it's like to work in a care home. They don't know what it's like to, the risk that people take when they're driving a bus. So when we're getting this data now, when we're hearing of people losing their lives because the workplace which they should be safe in is not prepared to protect them, then there's negligence. It's deeper than just the fact that these people have got underlying health issues. We know this. We know that when we look at London, we know how hard it is to get even a doctor's appointment. So if you have a niggle, if you're feeling unwell, how are you even going to have this checkup to make sure that you are ready to work in the environment, which could exacerbate your underlying health issue? And when we look at the response the government has to date presented to society, it's not good enough. We need the data to be revealed now. I'm concerned that if we wait too long, we're going to lose more lives. I think Public Health England need to come forward and say, yes, at the end, of course, we will do a more internal report which shows everything. But as we're going along, the data should be presented in such a way that we are putting in stringent barriers to protect people. One of those things is to be able to say that everyone can be tested if you work within the public authority sector. That is not the case. Only last week, Enfield Council, I had my meeting with the leader of the council, and she said to me that we now have a testing centre. The testing centre in Enfield, based in my patch, is open for 3 hours. That's not good enough. Who's going to be able to get there? The queue might be an hour. And we're hearing that it's been privatised, a lot of these testing centres. People are having to roll up and do the test on themselves or on their loved ones. This is outrageous. It is not good enough. We are sending people into war, into battle, and they do not have the protective equipment that they should have. And it is a crying shame. So it's important that we come together. It's important that we remember those that have lost their lives. But more importantly, the terms and reference of this independent inquiry must reflect not only that the government are negligent, but more importantly, we need to make sure that those people that lost their lives, they didn't lose their lives in vain. And I just want to just tell everybody, just please, let's stick together. Let's not allow them to pull us apart. This is affecting all of us. Nobody should be losing their life. And I send my condolences to anyone that has lost their life going to work and defending us and protecting us so that we don't get it. And I thank you.
Thank you, Kate. That was brilliant. I'd like to welcome our next speaker, who is also a vice chair of Stand Up to Racism and is here representing the NEU, who has been a fantastic supporter of Stand Up to Racism. I'd like to welcome the General Secretary of the NEU, Kevin Courtney.
Thank you very much, Sabi. And I am really pleased to be on this platform tonight with such wonderful activists and speakers on such a vital issue. As you said, I'm General Secretary of the National Education Union, Joint General Secretary with Mary Bowstead. She sends her greetings as well. We are the recent amalgamation of the National Union of Teachers and the ATL. We're the biggest education union in Europe. And I want to say that we are really proud to support Stand Up to Racism. And I want to just say quickly why that is. Teachers, educators see racism very directly in their schools. And I think it's really important, therefore, that they're part of the fight against it. We see, though, that as well as supporting things like anti-racism awareness training, which we do support, there is a need for an active anti-racist movement. And we think Stand Up to Racism is at the core of that movement. In my union, we've got an active Black educators section, a Black educators conference every year. We think Black self-organization really matters. But I think it really matters that it is not the job of black people alone to fight racism. It's the job of all of us in our society to fight racism. And I think on this Workers' Memorial Day, you know, we had the minute silence. I was giving thanks for the educators, for the care workers, for the transport workers, for the NHS staff. And it's really vital that we look at the statistics that we are seeing coming out of this about the disproportionate impact. So 2/3 of the NHS staff who have died have been of a black background, political black background. 1/3 of those in intensive care are black. All but one of the doctors who've died are black. And it's not just at the death end of the COVID thing that the discrimination happens. Black families are twice as likely as average to have lost income or lost jobs during this crisis. We need to look at all of those issues and consider how we're going to put them right. When you see statistics like that, you should be enraged. You should think that these figures should be recognized by the government. They should be measured properly, but that's not enough. They need to be investigated. There needs to be a thorough public inquiry. But it's not just about an inquiry, it's about taking action in the immediate and as a result of that inquiry. And I think it's really important that we think about the actions that we can take now, as well as the longer term actions that are needed. So we're starting to hear politicians talk about reopening schools. We're very worried about the safety aspects of that. But we're worried children who might pick up the virus at home, even if they don't suffer it at school, even if they don't suffer from it themselves, can take it home. Now, if you're taking it home to a family where, and this is more characteristic of black families, where your grandparent is living at home with you and where they may be vulnerable through diabetes, what is the risk that applies in that family? That needs to be investigated and spoken about now so that mitigation measures can be put in place. And if that means that child can't be at school, then we also need mitigation to make sure that that child isn't denied opportunities later on because they've missed some education in the here and now. That's action that needs to happen right now. Workers who are vulnerable, who are more vulnerable than the average, they should be allowed to stay at home on full pay. That's something my union's been fighting for. We've got lots of our members who are volunteering to be on the school rotas so that doctors and nurses can be at work. And we think that's absolutely right. We're supporting that those people should volunteer. But if somebody is more vulnerable, we say they should make their contribution from working at home. And I think that's a measure that we should be demanding now. But it isn't just, it's those immediate things. But when we come to this public inquiry that looks at why so many more black people have died or been seriously affected in this epidemic, I think in our gut, we know that that is not going to be a genetic contribution. There may be some genetic stuff. There's always some chance of that, but it's fundamentally going to be socioeconomic. It's about black people being at the lower end, along with many white people. And when you see that, if you don't deal with it, if you don't say we want to deal with those fundamental inequalities in our society, then you're not taking that public inquiry seriously. You're not taking the results of it seriously. And if we can make a world that's more equal for our black workers, then we'll make a world that's more equal for many white workers as well. So it's vital that we take those things up. I just want to say two more things. When we look back on this, we have to remember those pictures of the NHS workers and their names who have died. And we have to never, ever let any politician castigate migrants or castigate Muslims again. Those people have put their lives on the line for the rest of us. And I want to say this, I think the virus does not discriminate. The virus is attacking all of us, but our society does discriminate. But the fact that the virus is attacking all of us means that we have to think not just in our society, but worldwide. We need a program for refugees now. We need to say that refugees who are here legally so they can get to the health service. But we need to be thinking about a massive program of help to people in the third world, because the pandemic will do much worse for them. We need to say, and this isn't just a lefty point, we should stop the sanctions on Iran now because the crisis there is so immense. We should lift the embargo on Cuba now so that they can help other countries. It's a worldwide pandemic, as well as a pandemic in our country. And black and white have to unite against this pandemic in order that we can come through it, all of us together. Thank you very much for listening, for being on the call. Really pleased to be here with you.
Thank you so much, Kevin. That was a fantastic contribution. Thank you so much for that. And Kay Jan has said that they're proud to be an NEU member. And thank you to Kevin for doing such a brilliant job. I think Kevin raised some important points there, because I should add that the Financial Times analysis of the based on the Office for National Statistics stats show that the actual death toll is more than double that of the government's official figures. And given that there's all this talk of ending the lockdown, we're really concerned about that, because we think that there must not be any premature end to the lockdown, because it's having a disproportionate impact on BAME communities. So I just wanted to add that point to the great points that Kevin made there. So I'd now like to welcome our next speaker, who needs very little introduction. She is president of Stand Up to Racism. She is the former Shadow Home Secretary and an all-round wonderful leading anti-racist campaigner. I'd like to welcome Diane Abbott, MP.
Thank you. Can you see me?
We can. Great pick.
Well, I'm very pleased to be able to speak at this important meeting, and I'd like to congratulate everybody that's taking part. And the main reason I want to speak is to stress my support for an independent public inquiry of the subject of COVID and Black and minority ethnic persons and the completely disproportionate level of deaths. And it should be an independent public inquiry on the lines of the Macpherson inquiry, and hopefully as significant and transformational. Now, one of the reasons we need an independent public inquiry is we've had such an avalanche of misrepresentation and spin about COVID from the government. I've been a politician for quite a few years, but I've never heard so much representation. I've never heard so much representation about a matter of life and death. I've just seen a message that, what is the message? Turn my camera on. That's what I thought. Can you see me now?
Yes, we can, yeah.
Okay, so one of the reasons we need a public inquiry is that we've had a complete avalanche of misrepresentation and spin about COVID. First of all, on the question of protective equipment or PPE, you've had ministers turning up, often several on the same day, talking about how they are putting out millions of pieces of PPE. They're not sending out millions of pieces of PPE. That part of the reason they're arriving at these inflated figures is by counting each pair of gloves as 2 gloves, which is quite ridiculous. We need to get to the facts. We need to cut past the self-interested spin. That's why we need an independent inquiry. And one of the things the government has sought to misrepresent and ignore is the situation in care homes. It's only today that they've announced they're going to produce the daily figures for people dying in care homes. It's something they didn't want to talk about because it was very, very, very shameful what they've allowed to happen in care homes. A lot of people have made some important contributions. I'll just add this, that what has happened with BAME communities and COVID and the death rates among BAME NHS workers is built on the structure of a generation of structural racism in employment in the NHS. And when we have the inquiry, I think one of the things we will find is it's the kind of areas where BAME doctors and nurses and care workers were directed to. It's the kinds of roles that they were playing which made them more vulnerable to COVID. So we need a public inquiry. Very sadly, the public health executive have chosen to make Trevor Phillips one of their advisors on their inquiry, which I think means that their inquiry is dead on arrival. I mean, Trevor just has a history of making, for years, really unpleasant remarks about, well, race, I think in general, but Muslims as well, all framed in an Islamophobic framework. As the people will see, perhaps when they come away from this meeting, that in The Guardian tomorrow, there's an article saying that Trevor can only discredit this inquiry. So we need a public inquiry. We need to move from this very, very tragic situation. We all know people have died, to shed some light on structural racism in public health, structural racism in the NHS, and what we should be saying to the families of all the people who have died, both in the community and in care homes and amongst doctors and nurses, is that you are not forgotten.
Thank you so much, Diane, for joining us this evening. That was a brilliant contribution. I think you hit the nail on the head when you said the Public Health England inquiry is dead on arrival with the appointment of Trevor Phillips. So thank you again for joining us this evening. I'd now like to welcome our next speaker, who also needs very little introduction. He has been a huge supporter of anti-racist campaigns and has been an anti-racist campaigner for decades. I'd like to welcome the former leader of the Labour Party and MP for Islington North, Jeremy Corbyn.
Thanks, Abby, and thank you very much for hosting this call this evening, and for all those that have spoken in the call. They've been absolutely brilliant series of contributions. I want to particularly thank the colleagues who've been great in their solidarity in Parliament over the past 5 years, during which time I've been the leader of the party. That's Diane, who's done an incredible job in holding the government to account as Shadow Home Secretary and exposing the Windrush scandal. The work that Kate did as Shadow DFID and does all the time in Parliament, and the incredible work done by Bell, who was only elected to Parliament in December. And it's hard to realise she's actually only been in Parliament for 5 months. Incredible impression she's made, and she went straight onto the front bench to support the Home Affairs team. So I want to say thank you to them for all that they did and all that we do together to raise the issues of anti-racism and about justice within our society. And on behalf of all those that work so hard in all the caring areas, and Kevin is quite right that teachers should be included in this as well, to recognise the work that they do. I came onto this conference at about half an hour ago, because before that I was on another Zoom call with the Islington Trades Council. And the opening speaker we had was a wonderful woman called Siema, who is a care worker in a local care facility. And she described her job, described her work, and described the tragedies that she sees every day of vulnerable elderly people not being properly cared for. And then went on to explain that she herself has no recourse to public funds, as do many of her colleagues. And she made the plea, and she's right, and all those that are working so hard, protecting all of us in the NHS, in care, in street cleaning, in refuse collection, and so much else, deserve to know that they have the certainty of the ability to stay in this country at the end of this and be recognised for the work that they've done. And I think that's a real demand we've got to make. And also, the language that's been used by successive Home Secretaries of calling people unskilled workers. Just unravel that, just think about that for a minute. They describe worker A as skilled and worker B as unskilled. Well, we all rely on the skill of a cleaner to make sure the bus that we travel on isn't one that's going to transmit the virus. The train we travel on, the same. The streets we walk in are on, and also, of course, in the care homes and the hospitals. So let's never again dismiss workers who are low paid as being unskilled. Instead, demand decent pay for all of them. And the work that's being done by them, overwhelmingly Black and minority ethnic workers, doing an incredible job. They're the ones who've been looked down upon, who've been discriminated against. They're the ones that are absolutely the mainstay of our public services and our society. So when we come out of COVID, let's not allow, as others have said, the right in British politics to somehow or other get away with saying, well, you know, these are all low skilled, low paid, expendable workers. They need them now, and we're going to need them for all time, because that is the kind of movement we are and have to always be. Now, there are areas of inequality that have been exposed by COVID, both global and national. Let's deal with the global one first. The virus apparently began in China. Apparently, it was a transmission between a live animal market and a person who was handling live animals ended up getting this new virus. Viri do mutate and do develop all the time. It's not a simple thing. They're not a one-off. And reading the history of the so-called Spanish flu of 1918, in reality, was nothing to do with Spain. It was only called Spanish flu because the Spanish papers were the only ones that weren't under state control at that time and reported it. The virus actually first located amongst soldiers, American soldiers, and the US is the country that suffered greatly, but other countries in Europe did as well. It killed a very large number of people, killed millions of people. That particular virus did. It was global. This one is global. Now we have international institutions, most of which origins grew after the 1918 pandemic. And the most important of those that was finally formed in 1948 as a UN agency is the World Health Organization. Now, the World Health Organization is underfunded. It does its best to ensure that there are programs of vaccination and inoculation, that there are programs of public health. And its cornerstone has always been that healthcare should be a universal right, not a privilege, not something that you buy if you can afford it, but a right, as we have in this country through our brilliant National Health Service. However, other financial institutions, the World Bank, the International Monetary Fund, G20, and so on, don't see health in the same way. At the same time as investing in other countries, they've actually been allowing, if not encouraging, the development of a private health market in all of those societies. And so it's not a coincidence that Donald Trump decided to use the corona crisis as a means of withdrawing US funding for the World Health Organization. I think we should be supportive of the World Health Organization because it's important to have it, but also if we live in a world where there are grotesque levels of health inequality, and there are, then we're all vulnerable to Ebola, to SARS, to COVID-19, and there's many others that we're also very vulnerable to. And so I think the message there has to be, and I'll be trying to raise this tomorrow in Parliament, global health inequality is actually as bad as any other form of inequality, and we have to challenge it and point out also that the poorest countries in the world, particularly in sub-Saharan Africa, actually are net contributors to the world economy rather than beneficiaries from it because of the way in which debt repayments and commodity pricing and investment strategies actually work. So let's, in the examination of the global effects of this crisis, look at global levels of inequality and global levels of health inequality brought about by pollution, by poor environmental standards, and the way in which, for example, in New Delhi, the most polluted city in the world, life expectancy is seriously reduced because of those levels of pollution. But ironically, as a consequence of the coronavirus shutdown, with all the poverty and the death that's come with it, has been clean air temporarily. Maybe that clean air should be there permanently for all people. But it's also exposed inequalities within apparently wealthy societies. The death rate amongst the poor in New York, in Chicago, and other big cities in the USA is far greater than anywhere else. The instance of COVID is linked to poverty, is linked to poor environmental standards, such as bad quality air, but it's also linked to poor health services. And when millions of Americans are denied any access to healthcare whatsoever, they're the ones who are suffering the most. But as Kevin pointed out, and he was right to, COVID can actually infect absolutely anybody, and people react in different ways to it. And so we have to learn a lesson from that. And in this country, when the World Health Organization first identified COVID as a danger, they said, first of all, they notified a concern. They then notified the dangers of it. They notified it that it was an epidemic, and then later labeled it to be a pandemic. What was the response of our government? To preside over a health service that had 94% bed occupancy in December, where there were more than 1 million people at any one time waiting to go into social care, with social care homes very often very overcrowded and therefore breeding grounds for all this. They then developed this philosophy, a strategy of herd immunity, the idea being that a proportion of the population is infected and develop a sort of immunity to it through the herd having absorbed it, and many suffered and died as a result of it. This is crazy theories. Surely the human instinct is we support each other, and that means you invest in health, you invest in social care, you pay people properly, you don't denigrate those that work within it, and you also make sure that you're capable of dealing with a crisis, a flood, an earthquake, a fire, whatever it happens to be, and you have the necessary resources. Where was the PPE? Where was the backup? It simply wasn't there. And even from January onwards, when they had time to introduce testing, when they had time to buy the PPE equipment, they still didn't do it. And thus we have a high death rate and a very high instance of COVID across our society. And so, as we unite to fight back, to try to deal with COVID, we also must remember the levels of racism that have been attached to this. I went to Manchester, and my first port of call was a meeting with the Chinese community and a visit to Chinatown in solidarity, in January, in solidarity with those that are suffering because of COVID, but also in solidarity with a community that was being abused because they said it's a Chinese problem and Chinese people automatically spread COVID. The ignorance, the stupidity, the racism and the nastiness surrounding it was there for all to see. And so I think the legacy of all this has to be that we recognize the value of those who do work within our caring and healthcare professions, and we recognize them, and we don't allow the hostile environment to take over and treat them so badly in the future. And we recognize that globally, it hasn't been equal in its effect. And in the refugee camps in Lebanon, in Jordan, in Libya, in Bangladesh, in Turkey, and other places, the dangers of the spread of COVID are absolutely huge. So unless we live in a world where we genuinely care for each other, then we're all vulnerable, however rich or poor we are, within our own societies. And learn those lessons. But above all, let's have that sense of solidarity with all those that have contributed so much, and all those Black and minority ethnic care workers, bus drivers, nurses, orderlies that help in different ways and work in different ways in hospitals, and all the incredible number of people from all our communities that have volunteered to help with the food banks and helping those people suffering from isolation. Let's defeat the racist and racist ideas that go with it and show how strong we can be as a society and as a movement. Thank you very much.
Thank you, Jeremy. I think it's a real shame that you're not our Prime Minister right now. Best wishes and solidarity with you, and thank you so much for joining us this evening. I think
Don't worry,
Jeremy...
I'm not disappearing anywhere. I'm around. Okay.
Thank you. Brilliant. Glad to hear it. So I think Jeremy made some brilliant points there. I think that there are, two different approaches to the approach to the coronavirus in the world. So you've got countries in the sort of Asia Pacific region, including New Zealand, that have, slightly different strategies, but they effectively want to get rid of the virus. That's their overall strategy. But then in the US, Britain and Europe, I think, especially in this country, in the US, you effectively have a herd immunity by stealth approach. Because I think the only reason why we have a lockdown is because of the impact on the NHS, and the government didn't want to overwhelm the NHS. And so I think there is an attempt now where the infection still exists, but where there's an attempt to end the lockdown, and people are just still expected to go to work as normal, even though the infection still exists. So that can only mean more infections and more deaths, and disproportionately on the BAME community. So I think it's really important that we oppose that. And that's why Stand Up to Racism has launched a statement that we agreed at a meeting last week that Diane, Abbott and others have signed, that is essentially demanding no premature end to the lockdown, and of course an independent public inquiry into the disproportionate impact of the coronavirus on BAME communities, and as the BMA have said, to for the NHS and care homes and everyone to record the ethnicity of all COVID-19 patients. So I just wanted to draw attention to that. So look out for that, guys, because we will be launching that as a petition. So please do sign up to that. And our final speaker for this evening is a councillor in Islington. She's a Labour councillor, and she was also came to this country as a refugee, and it just shows the contribution that refugees can make to this country if we just allow them to be human beings and give them indefinite leave to remain and get on with their lives like everyone else. Micheline has been an outstanding campaigner against racism, and she's a brilliant local councillor. I'd like to welcome Micheline Ngongo.
Good evening, everybody. I don't know if you can hear me.
Yes,
can you hear me? Okay.
Yes.
I'd like to say thank you very much for inviting me. But Sabi, I can speak only for 2 minutes because I'm between 2 Zoom meetings. I have to finish the other one. I'm between 2 things. The only point I'd like to raise is again to plead with everybody, because we do have our fellow brothers and sisters around British border in Calais and Duncan, where they are funding ready free case of coronavirus, which is very serious situation we are facing right now. We know in Britain or in France is a serious situation. As we said, coronavirus is killing only human race, meaning we need to stand in solidarity with our brothers who are living in the refugees camp. If we people were outside the refugee camp, we found it very difficult to cope with the coronavirus. What happened about the refugee camp, where they don't have resources and no one is keeping an eye to help them? It's become a disaster. Because last time when we had the meeting last week, we circulated a mention from Amnesty International, really to push Britain and France and different countries to help, especially to rescue young children who found themselves in refugee camp. I'm pleading again this evening on behalf of refugees, please, we need to help them. Thank you.
Thank you, Micheline. And that's an excellent point there. because I think that it's possible, if the government has the will to do it, to keep everyone safe and deal with the infection properly, and also adhere to its international duty to help and provide sanctuary for refugees. They can do it, but I think they don't want to. They just want to ignore the fact that there are refugees in northern France and in the Mediterranean that are just being left to die, and that can't happen. We have to provide a sanctuary for refugees. We've got an international obligation to do so, and we have to invest in the equipment to keep everybody safe and treat everybody from COVID-19, and we have to provide a sanctuary for refugees. So thank you for making that excellent point. That's something we shouldn't forget. So my final request to everybody before we say goodbye, I want to ask you to make a donation to Stand Up to Racism. You can find the link on our Facebook page or go to our website. Please make a donation to our work, because we can only continue all this online campaigning if we keep the funds and the donations coming in. We've had lots of donations. People have been very generous recently, but we can only put these things on with your help. The right wing have, very rich supporters. We don't have that. We've got something better, and that's you. So we just want lots of small contributions from lots of different people. So we're not expecting a lot, whatever you can afford. I know things are difficult at the moment, but if you can spare some cash, then please do send some our way. And thank you to everyone for joining us this evening. Thank you to Jeremy, to Diane, and all of our guests this evening. Brilliant speeches. And thank you to all of our viewers. We've had 1.7 thousand people joining us this evening. That's fantastic. Thank you to all of you. Thank you for the brilliant contributions. And I want to wish you all the best, and please do keep safe and well, and don't go out if you don't need to, and make sure you're safe when you do need to go out and you're socially distancing properly. So thank you everyone, and good night.